First, up at the level of the neck, it branches off of C5 to T1, so the full gamut of that brachial plexus passes through all the aspects of the brachial plexus, and then the posterior cord gives off the radial nerve. The radial nerve then passes through the triangular interval. It then quickly, right away, gives off the long and medial triceps head. About mid-humerus is where it gives off the lateral head of the triceps innervation point. The anconeus muscle branches off relatively high and then innervates relatively low. The anconeus is one of these muscles that is not present in everybody, and research varies widely. Some research says that it'll be present in 3% and some as many as 37% of the population. But when you look up radial nerve innervation charts, like the little bone chart that shows all the innervations, a lot of them don't even include anconeus. Brachioradialis also branches off above the elbow and innervates that muscle down a little lower. The deep aspect, or the posterior interosseous nerve, and the superficial branch, they separate about 1 centimeter below what we call the transepicondylar line. The posterior interosseous nerve then innervates ECRL, the extensor carpi radialis, ECRB, extensor carpi brevis, and the supinator. Now this is where we start to get into a whole lot of variation in the literature, and you can find, if you find 10 different sources, you'll find 10 different versions of the order of innervation of that posterior interosseous nerve. Generally accepted that the ECRL is proximal to the split off of the posterior interosseous nerve. Sometimes you'll find that the supinator and ECRB are also above that. Sometimes they're below, sometimes their order is switched, but there's a lot of anatomical variation on where that branch off happens, and then a lot of variation on all of the muscles within that PIN innervation order. What we do know is that typically we see innervation of EDC first before we see innervation of thumb muscles, and last is always the extensor indicis proprius. So that one's always the last one in the line, but everything between there is kind of jumbled up a little bit. That superficial branch of the radial nerve has a couple of different names. It can be the dorsal sensory radial nerve or the superficial radial branch. Lots of different names for that one, but basically it runs superficial down the forearm, down the anterolateral aspect of the forearm and over the dorsal distal radius. It then passes over the snuff box and to the dorsum of the hand and the radial digits.